It's a story we first brought you here on Daybreak about a year ago, and it has a very disappointing outcome for our next guest. Nicole Pallone's 5-year-old daughter, Rosie, has PKU, phenylketonuria. It's a rare cognitive disorder that seriously affects brain development. The good news is there is a drug along with a strict diet that makes life a whole lot better for Rosie. The bad news? The province has chosen not to fund the drug and much of the diet as well. Rosie is one of about 150 people in BC affected by PKU. Her mother, Nicole Pallone, joins us on the line this morning from Sparwood. Good morning, Nicole.
Good morning.
PKU is rare, and I'm guessing most of us don't know what it is. What is it, and how does it affect your daughter?
It is quite rare. About 1 in 15,000 babies here will be born with it. In a nutshell, it's a very, very complex disorder, but in a nutshell, there is one amino acid in protein called phenylalanine, or Phe for short, that her body can't process the way your body and my body can. It results in a buildup of Phe, which is then toxic to the brain. So undiagnosed, untreated, she would have been completely mentally retarded by the age of 3.
Now, what's her life like at the moment?
At the moment, she's doing very well. She's meeting all of her expectations for her age group. That is largely because we have worked hard to ensure that she has access to all the treatment options, even though they're not funded by the BC government.
Okay, and we'll talk about the drug here in a moment, but I want to talk about the diet, because if she doesn't have this amino acid, then what can she eat and what can't she eat?
So we have to restrict all her protein intake very, very severely. She can really only have fruits and vegetables, which we have to weigh and calculate the known Phe factor, I call it, for each food, and hit a certain target every day. Then on top of the fruits and vegetables, she does get an amino acid formula that replaces all the other amino acids that she's therefore lacking from her diet that she needs, and special medical low-protein foods which help provide the calories that she needs so her body doesn't break down its own proteins, which would also result in a high Phe level. And those are things like pasta and rice, and there's low-protein hot dogs, and there's low-protein burgers. There's lots of low-protein foods, but they're very, very expensive. And they're funded in every province in Canada, almost except BC.
And there's also a drug that can help. What is that drug, and what does it do?
The drug is called Kuvan. What it does is it floods the system with the cofactor that the enzyme needs to break down the Phe. It gets pretty complicated. But what it does for it only works in about 40% of patients, but what it does for them is it helps them lower their Phe levels, have better control of their Phe levels, and in many cases increase the amount of natural protein they can consume.
So it's like a catalyst that helps the body along.
Exactly.
Okay, so all of this together, the drug and the food, how much does all of this cost you sort of on a monthly basis?
The foods, we spend about roughly, it varies depending on her appetite and what she needs, but we've asked the government to fund up to $2,000 per year per patient, which is really a drop in the bucket when it comes to the health budget for the foods.
It's like $150 a month or something like that.
Sure, yeah. But that's a real impact for some families. And again, in many other provinces, they have unlimited funding of these foods. The Kuvan, we actually don't have to pay for it right now. Rosie's in a clinical trial, so her drug is provided free of charge to us. And as for the exact price, that's hard for me to say. The BC government spent a lot of time negotiating with the manufacturer about cost. We're not privy to those discussions. What I do know is that the BC government was offered the best financial package available to public payers. And this is a drug that is publicly funded in many, many other countries.
And in the U.S., it costs, I think, the number I saw was about $55,000 a year. So it's expensive.
It's a weight-based medication, so it does vary by weight. Somebody like Rosie is going to be a lot less expensive than a PKU adult, for instance. But that is a reasonable estimate.
Now, the government has declined this funding and for the food. What did they tell you about why?
Not a whole lot, to be honest. In some ways, I feel for them. PKU is a very, very complex disorder, and they really, I don't feel, have a good understanding of what PKU patients face or how these treatments can help. There's lots of scientific evidence to back that Kuvan is not only safe and effective, but also that the diet alone, while it does improve outcomes significantly, patients still suffer a lot of neurocognitive issues.
Now, we did contact the Minister of Health, Margaret McDermott, who incidentally is a physician, and we asked her about PKU, and we have this tape. Just let's listen to what she had to say.
The ministry has reviewed this, and they look to experts for advice. So they looked at the Common Drug Review and the BC Drug Benefit Council's recommendations, and the current recommendation is not to fund this drug, Kuvan, for PKU patients. The advice that the ministry received was that the benefits were not clear, and also the high drug costs of up to $180,000 per year for an adult.
Okay, the cost aside, the benefits are not clear. What do you make of that?
It's interesting. In my mind as a parent who did a lot of research before I ever even considered putting my 20-month-old daughter on a drug, there's tons of evidence out there. There really is. The tricky part is that it is almost impossible without trying the drug to know who will respond. I don't know why that seems to be a stumbling block, because there's no harm in trying it and then finding out and then only funding the ones who do respond to it. As far as the Common Drug Review, I've said for many years now that the Common Drug Review in its practice doesn't work very well for orphan drugs. It's not a common drug. It's impossible for us to live up to the same kind of scientific standard required as common drugs, because there's quite simply not the same population base to gather that kind of scientific data. And
as you say, Rosie's in this clinical trial and you are on this special diet. What happens to her now? I mean, you'll continue those things, I would assume, but what will life be like for her and for her cohort in the next 10 years in BC?
Well, we'll only be able to continue the drug until the clinical trial is over, and then it's quite likely that we won't be able to access it. Even at her low weight, it is still an expensive drug as far as a family goes. So that will be pretty heartbreaking to know that it's been helping her brain develop properly, and that she won't have access to that. It's just totally unfair.
Is there anything the government can do to review that? I mean, is there any sort of arbitration process or second look at this?
Well, I'd really like to meet with Minister McDermott, and I've been trying for 3 years to get a meeting with the Minister of Health in BC. It has yet to happen. I was very excited to hear that Minister McDermott is a doctor. However, I do know from a friend who's in med school that they literally get less than 1 day of training on PKU. So unless she's had some direct experience with a patient, she is probably, not as knowledgeable as she needs to be to make a proper decision. And the thing I really want to emphasize is that I'm not going to stop. I'm not trying to be a bear, but I'm not going to stop working and pushing and fighting until Rosie and every patient has access to the tools they need for all the treatment options. Nobody really understands the challenges these patients face until you live with it. And the really sad part for me is that my kids won't be little much longer. And Rosie starts kindergarten next year, and I've spent most of her life fighting for access to these treatments. And instead of just playing with her and watching her grow and watching her little sister grow, I'm spending a lot of time fighting for something that should just be covered.
Nicole, it's been good to talk to you this morning. Thanks for joining us.
Thank you very much.
Bye-bye. Nicole Pallone is from Sparwood. Her daughter has a rare cognitive disease, PKU. The province won't pay for that expensive drug to combat it.